guys, this is outpatient labor and delivery. This is going to be one of your primary responsibilities as an intern. You will get a page on your pager which will let you know that you need to call back here, find out who the patient is, what's going on with them, and then you will actually come back here, talk to the patient, gather all the information. Anytime you do a cervical check, you need to have a nurse with you, and they're happy to come in there with you and check behind you if need be. Once you've gathered as much information as you can, it is a good time to call one of your upper levels. If it's a term patient, you can call your second year. If it's a preterm patient, that always needs to be run by your chief, but that can be through your second year. So come here, evaluate, and check out to your second year, and kind of keep. The goal is to get people admitted or send them home. Those are the two options. This is one of the outpatient rooms. This is kind of the bed. It can actually pull out and make stirrups, which we'll show you when you get here. This is where the monitors hook up. Gloves and gel are up here, as well as towels and gowns in case you ever need anything. Or if you have a precipitous delivery, you need just a towel and some gloves really fast. Sometimes that happens.
Hey, I'm Gwen. I'm one of the nurses in outpatient labor and delivery, and basically what we do here is triage and or monitoring for women who have problems with the pregnancy. We get anybody who's basically over 20 weeks, whether that be from the office or the EMS or when they walk off the street. So they'll come in and we will start an assessment, and we'll usually get some things ready before we call you all. And by then you'll come over and hopefully we'll make a plan together and send the patient either to labor and delivery or to home or to the maternal fetal medicine unit. We like to get patients out of here within a couple of hours. So our goal is to assist you in any way possible. It's really important before you go in and check a patient to have one of the nurses come in with you, and we're happy to check behind you if you want us to do that. But yeah, it's good to have a chaperone. Just protects everybody involved. So welcome.
So as an intern on labor and delivery, we have several responsibilities. The first is to manage the active laboring patients on the floor. We check on them and write notes about every 2 hours. We also do cervical checks, but those are always with a chaperone, so we usually go in with a nurse or another resident. We're also responsible for writing notes on patients on magnesium. These also need to be frequent to watch for magnesium toxicity. We write magnesium notes on patients every 2 hours. We also answer pages. We handle patients in outpatient labor and delivery to rule out labor and admissions for patients in labor. And we also take care of the postpartum patients up on mom baby, answering pages, questions about them, and checking on them every morning. So a lot of times labor and delivery can get really busy, and sometimes a lot of tasks have to be done simultaneously. So don't be afraid to ask your upper levels and other residents to help you out with some of that. As well as using the nurses as a resource. The nurses are great teachers. They've been doing this for a long time, and they're very helpful in your training process.
Hey, we want to welcome you to Labor and Delivery here at Mission Hospital. We're really excited to have you. We want you to feel comfortable with us as nurses and know that we're always at your side and got your back if you need us. This is one of our typical labor and delivery rooms. We have two types of rooms. This one is not a water world room. But it is a larger room, and we usually have one side of our hospital is kind of facing the interior of the hospital. The other side has nice mountain views. This just happens to not be one of those rooms. As you walk into the door, you guys will have all of your gloves here for delivery. These are all your sterile gloves, and then any apparel that you need for the actual delivery, masks, booties, and hair. You don't need to pull your hair back necessarily, but we will give you a gown. It'll be on the delivery table when you come in for delivery. So when you want to come in and check a patient, check their cervical dilation, you can grab one of us nurses, and we'll help you with that. And we'll always check behind you if you feel like you need that. Here's where you'll grab just a single glove, sterile gloves, medium and large, and then there's gel in there for the exam. And then on the drawer below is internal monitors, just in the event that you would ever need one, and we will set those up for you, just so that you know where they are. On the left side of the bed is where we keep our oxygen. Hopefully we won't need to use it, but if we do, this is where it is, and masks are right below. So for the actual delivery, the patients are allowed to have 4 visitors at a time. It can get kind of crowded, and some drama can evolve from that, but normally we try to keep it as calm as possible. You will be in here with the resident, higher level resident, and then the attending physician. Most times we don't need the NICU team, but if there is the need for that, we have what's called a stable team, which is a NICU respiratory therapist and then a NICU nurse. And that would be for meconium or vacuum extraction and other issues. So it can get a little crowded, but these rooms are nice and big, so that'll accommodate you.
While on this rotation, your home away from home will be the 4th floor and the 5th floor, the east side of the hospital. Outpatient labor and delivery, and the maternal fetal medicine unit are all on the 4th floor, while mother-baby, where patients recuperate postpartum, is on the 5th floor. For your shifts on labor and delivery, you should wear scrubs, closed-toed, comfortable shoes that would be appropriate for both surgeries and deliveries. The scrubs are available in the dispensers in the middle of the labor and delivery hallway. For deliveries and for surgeries, add a hat and mask and some booties to cover your shoes. Your responsibilities in the morning begin at 5:30 a.m. on mother-baby. Postpartum patients are rounded on by the interns and checked out with an upper level prior to formal rounds. Formal rounds begin each morning at 7 a.m. from Monday to Friday and 7:30 a.m. Saturday and Sunday, and are held in the library on the 4th floor around the corner from the maternal fetal medicine unit. If you are discharging a patient, you need to prepare the patient's documentation for discharge prior to formal rounds, but wait and put the discharge order in immediately after rounds. During your shift, you'll be carrying the first-year pager, answering questions from the nurses on mother, baby, and labor and delivery, also accepting admissions to labor and delivery and maternal fetal medicine. We expect you to work closely with our nurse midwives and upper-level residents to learn about the care of routine labor and techniques for the vaginal delivery and postpartum care. We also would like for you to be involved with our high-risk patients under the supervision of an upper-level resident. Evening checkout rounds are held at 5:45 in the library, and you should be prepared to present your patients at that time. Documentation responsibilities for interns include creating a paper rounding list that will be used by the team for morning and evening rounds, and also updating the dry erase board in the library. Using PowerNote and the computer, you will be creating admission H&Ps for patients being admitted to labor and delivery and sometimes maternal fetal medicine. You'll also be creating 2-hour notes on patients who are in labor, as well as patients receiving magnesium for preeclampsia. Notes might need to be written more frequently for patients whose status is changing rapidly. You should start putting information into the DPART summary as soon as the patient is admitted, and then have that DPART summary completed by the time the patient is discharged. All delivery notes and history and physicals should be forwarded to the attending. Throughout the 2 rotations during your first year, we hope that you are exposed to a wide variety of circumstances that arise on labor and delivery. By the end of the year, we would like for you to feel comfortable with normal spontaneous vaginal deliveries, artificial rupture membranes, intrauterine pressure catheter and fetal scalp electrode placements, Leopold maneuvers and bedside ultrasounds for presentation and estimation of fetal weight, non-stress test and contraction stress test administration and interpretation, episiotomies with repair, maneuvers for shoulder dystocia. We will also expect you to first assist with the privates doing their own C-sections. First-year OB residents will perform cesarean sections and bilateral tubal ligations as part of their labor and delivery rotation during their first year. We expect prompt and professional response to all pages received during your shift. It would be nice to see new patients in a timely fashion and finish that documentation as soon as possible. In order to enhance the patient's experience and resident education, it's nice to have some continuity following patients on labor and delivery. As previously noted, it's very important to ask for a chaperone for all pelvic exams and procedures. Until you have a blue card documenting that you are proficient in cervical exams, it's important to have an upper-level resident or a nurse midwife follow you and repeat the exam immediately after. Our goal is to have happy moms, healthy babies, and overall good outcomes. And in the process, we hope that you learn a lot and have some fun along the way. Welcome to Mission and to MAHEC, to your labor and delivery rotation.